What is chronic kidney disease-associated pruritus CKD-AP? CKD-AP is very itchy skin. That is most common in patients with advanced CKD and end-stage kidney disease-esque, but which can also happen in the early stages of CKD. CKD-AP is also known as uremic pruritus because the buildup of toxins and wastes in damaged kidneys, known as uremia, has been associated with itching. Recent scientific evidence suggests that uremia is not the exclusive cause of itching in CKD. As a result, the more appropriate name for this condition is CKD-AP. CKD-AP can bother patients a lot and get in the way of daily life. Scratching to stop the itch can harm the skin, so finding the right treatments is very important. CKD-AP affects each person in a different way, so you need to work with your doctor and healthcare team to find what works best for you. Because CKD-AP is often ignored by both patients and their healthcare team, patients may not get the relief they need. This can lead to loss of sleep, shorter or missed dialysis sessions, fatigue, depression, and infections, among other problems. What causes CKD-AP? The cause is not fully known, but many changes in the body related to CKD may cause itching. Certain lab values found in people with CKD, such as low white blood cell count, may mean that the body is inflamed. Itching due to this immune response is known as the immune theory of CKD-AP. Studies have also shown that signals sent to opioid receptors in nerve cells may be off balance in CKD, which then leads to itching. In CKD, the mu receptors become too active, while the kappa receptors are blocked, which is not normal. This imbalance is known as the opioid theory of CKD-AP. These are other factors related to CKD and EST that may be related to CKD-AP. Not enough dialysis for proper removal of toxins and wastes. High parathyroid hormone THE levels in the blood, a combination of high calcium and phosphorus levels in the blood. High magnesium or aluminum levels in the blood. Cells in the body release histamine and other chemicals that cause itching. Shrinking sweat glands cause very dry skin, also called xerosis. Shrinking sweat glands cause very dry skin, also called xerosis. How is CKD-AP diagnosed? CKD-AP varies in the way each patient experiences it, ranging from on occasion and hardly a problem to constant and very disturbing. It may happen at any time before, during, or after dialysis, night and/or day. In up to half of patients, CKD-AP affects the whole body, and in that case, it usually affects both sides of the body. But it can also only affect one part of the body, usually the face, back, and the arm with the vascular access. CKD-AP is known to be made worse by extreme hot or cold temperatures, stress, physical activity, and showering. CKD-AP can happen without any signs on the skin, or it can happen along with xerosis, or it can include itching, skin sores, and skin infections. Because CKD-AP is a common condition in the advanced CKD and dialysis populations, any itching in these groups could be from CKD-AP, unless there's another clear reason, such as liver disease or a drug reaction. The diagnosis of CKD-AP requires a team effort that centers on the patient's report of their symptoms. Healthcare professionals may choose to do a skin exam, assess common dialysis lab values, and try topical treatments in order to pinpoint the diagnosis. How is CKD-AP treated? Patients on dialysis should be treated for high THE, phosphorus, and magnesium levels in the blood. This may include certain medicines, increasing dialysis treatment times, and/or changing the type of dialysis filter or dialysis prescription. All patients should start with topical treatments that are rubbed on top of the skin, including emollients, which are creams and lotions that soothe and moisten the skin, and/or analgesics, which are creams and lotions that relieve pain and itching. If those steps don't work, then allergy pills called antihistamines may help. Some of these drugs can make you sleepy, sedated, So other types, such as loratadine that don't make you sleepy might be used during the day, and the ones that make you sleepy can be used at night. For patients who are still itchy despite topicals and oral histamines, drugs used for nerve pain, including gabapentin or pregabalin, can be tried since the neural pathways for both pain and itch are related. If these drugs don't work, there are other treatment options, such as ultraviolet UVB phototherapy for patients who are not kidney transplant candidates. UVB therapy is associated with an increased risk of cancer and should not be used in patients who are on immunosuppressant drugs. UVB therapy should not be used in patients with systemic lupus erythematosus because of photosensitivity. If you have kidney disease, you won't see early warning signs on your skin. However, as the disease progresses, you may develop one or more of the following. 1. Extremely dry skin. Skin can become so dry that it becomes rough and scaly, feels tight and cracks easily, develops fish-like scales. Extremely dry skin is common in people who have end-stage kidney disease, which requires dialysis or a kidney transplant. 2. Itchy skin. Extremely itchy skin is a common symptom of advanced kidney disease. The itch can range from irritating to life-disrupting. Your skin may itch all or most of the time. Some people have itch on one area of their skin. The itch can also spread across most of your body. 3. Scratch marks and other signs of scratching. When you scratch often, it affects your skin. You can develop raw, bleeding skin or sores, thick, leathery skin lichen simplex chronicus, firm, very itchy bumps nodularis prurigo. If nothing seems to relieve the itch, you may want to see a dermatologist. Some people who have end-stage kidney disease get relief from a treatment called UVB phototherapy. 4. Color changes to your skin. When the kidneys stop working as they should, toxins build up in your body. This buildup can cause color changes to the skin. You may see any of the following: an unhealthy pale color, gray hue, yellowish color, areas of darkened skin, as shown here, yellowish, thick skin with bumps and deep lines, cysts and spots that look like whiteheads. The last two develop when you've had itchy skin for a long time and scratch often. 5. Nail changes. Kidney disease can affect the appearance of your fingernails, toenails, or both. People who have advanced kidney disease can develop a white color on the upper part of one or more nails and a normal to reddish-brown color below, as shown here. Half and half nails. Pale nails. White bands running across one or more nails. Murakis nails. Because your nails reveal a lot about your health, see your doctor if you notice any changes to your fingernails or toenails.